Hi, my name is Andrea Leonard. I'm a 32-year cancer survivor and president and founder of the Cancer Exercise Training Institute. My cancer journey began when I was 15 years old and my mother was first diagnosed with breast cancer. This was a time when I knew absolutely nothing about cancer. She had a modified radical mastectomy, which left her with permanent nerve damage, causing her to spend a summer detoxing at Johns Hopkins after becoming addicted to narcotics to manage the pain. She was also never told to move her shoulder after the surgery and ended up with a frozen shoulder. So she had to go through months of painful physical therapy. And these things could have been avoided had there been education like there is today. 3 years later, I was diagnosed with thyroid cancer. I was getting ready to go to college and they found a lump in my throat and I had a complete thyroidectomy. And this is what really molded me as a person and a professional. I went to University of Maryland, graduated, and then decided to become a personal trainer. So I got certified by the American Council on Exercise, American College of Sports Medicine, National Academy of Sports Medicine, and the Cooper Institute. I'm also a corrective exercise specialist through the National Academy of Sports Medicine and have been a continuing education provider for these organizations for many years. In addition, my entire family seems to have been plagued with cancer, starting with my mom's second diagnosis of breast cancer, which was approximately 20 years ago. And it was at this time that she asked me to help her in recovery so she wouldn't have to go through the pain and agony that she went through the first time. I was a pretty new personal trainer. I'd been training for about 5 years, and I was the director of personal training at the National Capital YMCA. I had been training her breast surgeon, Catherine Alley, and I said, what do you think about writing a book on exercises for breast cancer survivors? And of course, this was a time where there was nothing. There was no internet. I barely knew how to use a computer. And she said, that would be an amazing idea. There's nothing out there. This would be an incredibly valuable resource. So I worked with her, Ted Sangaris, who was the chief of breast surgery at Georgetown at the time, and Shauna Willey, who was at George Washington University, along with a group of other professionals. And we spent 3 years writing essential exercises for breast cancer survivors, which to this day is the only comprehensive manual written directly to cancer patients that takes them through a progressive resistance program. And this has been kind of the Bible for breast cancer patients and survivors. Realizing that there was a much greater need, it eventually developed into the Cancer Exercise Training Institute, where we cover all different types of cancers and surgeries and treatments and everything there is to know about cancer and recovery through exercise. So after my mother's second modified radical mastectomy, she decided to undergo reconstruction. She had not done that the first time. So she decided to do an abdominal tram where they actually took her rectus abdominis, tunneled it up through her torso to create a breast in the original site. They wanted to use her own tissue because of the nerve damage, and then they put an implant on the other side. They did not leave a large enough skin flap. The tissue was pulled way too thin, and as a result, she got continual staph infections over the course of 10 years, which led her to eventually get that removed as well. As you can imagine, psychologically as well as physiologically, it had a huge impact and continues to this day. And this is what motivated me to help other women like her to not have to go through some of these debilitating issues that are completely preventable. Additionally, my father was diagnosed with prostate cancer and bladder cancer, and then he had what was called myelodysplastic disorder, which was a pre-acute myeloid leukemia, and he unfortunately passed away a year ago. All three of his brothers had prostate cancer, and one of them also had pancreatic cancer. Two of his sisters had breast cancer. One of their daughters and one of their granddaughters had breast cancer. My cousins had brain cancer, non-Hodgkin's lymphoma, cervical cancer, pancreatic cancer. Both of my grandfathers died of lung cancer. One of my grandmothers died of stomach cancer. And currently, my mother's brother has aggressive prostate cancer. So as you can see, I'm very passionate about helping cancer patients because I believe that exercise not only helps them to recover to where they were before they had cancer, possibly even better than they ever were, but also it can prevent future incidences of cancer, among many other things. So let's talk about what is the role of a cancer exercise specialist. For starters, we want to improve overall strength and flexibility. Especially since we're dealing with a lot of baby boomers, many of them have never exercised a day in their life. And this is a time we can actually introduce activity into their life and help them to reach new heights in strength, flexibility, and overall endurance. We can also correct muscle imbalances. And to give you an example, following a mastectomy, there is tightening of the chest. There can be scar tissue, adhesions. In addition, there can be damage from the radiation, which will actually cause the shoulders to round in or protract. And oppositionally, the upper back muscles become overtaxed and weak. So we need to open up the chest and use corrective exercises to strengthen the back and stretch the chest simultaneously. If we were to do pushing activities like a bench press or even push-ups, that can exacerbate the round shoulder syndrome. So the combination and choices of exercises we pick are critical in the end result. Additionally, following, let's say, an abdominal tram reconstruction like my mother underwent, there is a period of time where they will be flexed forward as there's a huge incision from hip bone to hip bone. Combination of fear, pain, and tightness and restriction from scar tissue and adhesions can cause them to bend forward. And then several months later, what we see is the imbalance from lacking the abdominal muscle and overcompensating in the lower back. So we start to see lordosis or exaggerated curve in the lower back. All of these things, I believe, can be corrected through the proper combination of strengthening and stretching. So it is critical for you to understand how to assess that and then to create an exercise program. And we will have, in one of our later modules, we'll have an entire section on conducting a postural assessment and using goniometry to measure range of motion to help you to do just that. Additionally, we can prevent and manage lymphedema. Lymphedema is the swelling of the extremity or an area of their torso following radiation and or removal of the lymph nodes. What happens as the lymphatic system is damaged, it can cause a backup of fluid as the pathways become restricted. And if not caught early on, this can be a permanent disease. It is also progressive and very painful and can be very debilitating. I term lymphedema as needless suffering. I would say that 95% of the people, cancer patients that I have talked to, were never even told about lymphedema. And to me, this is so negligent. I don't know where the ball gets dropped, but they're not told that they're at risk, and they're certainly not told how to prevent it. So as a cancer exercise specialist, you have the ability not only to work with them in exercise, but to educate, to go over the many ways that they can prevent and identify lymphedema at its earliest stages when it's still potentially reversible. And that is a huge gift that we can give to cancer patients. We can also increase range of motion and correct postural deviations. The postural deviations go along with the muscle imbalances, but range of motion following radiation, following surgery, as they have the scar tissues, the adhesions, the lack of mobility, and they try and move through a plane of motion, whether it be their arm with breast cancer or maybe it's their leg after a lower extremity cancer, these movements can be seriously limited. So we'll be able to identify them with the goniometer and choose exercises that will help them to regain range of motion in that plane. And you're going to hear me say a number of things over and over through these videos, one of which is we always want to address range of motion issues prior to putting any type of load or resistance on that limb. And I say limb because it could be a leg, it could be an arm. We don't want to increase strength in a limited plane of motion. So for example, if I have limited flexion and I can only raise my arm to here, What purpose does using weights serve to only raise my arm to here? I will never regain complete range of motion. So this will also go into our equation or our exercise programming. And it really is like a mathematical equation. A plus B plus C plus D equals E, which is the end result. And that's how we're going to address this through this video series. Additionally, we're going to reduce pain and fatigue. Most cancer patients are going to have some degree of pain, whether it's from the treatment, the surgery, radiation, any combination, and 76% of cancer patients will suffer from fatigue, and this can be mental and or physical fatigue. So it may affect their attention span. There can be difficulty in learning and remembering things, and then also they just don't have the energy to do the things they usually do. But on the bright side of things, we know that exercise can produce endorphins, which will increase their energy. So that is one of the many reasons that exercise should be recommended to cancer patients at all stages of treatment and recovery. Of course, with their doctor's permission. They must have a medical clearance. And lastly, as a cancer exercise specialist, we are going to design, prescribe, and teach personalized programs. Now, if you're a personal trainer, a group exercise instructor, yoga or Pilates instructor, I use the word prescribe very loosely. Technically, we should not use that term as it is medical terminology, so call it what you will. But this is also to the medical professionals out there, because as a cancer exercise specialist, you might be a nurse, you may be a doctor, a physical or occupational therapist, or anyone in the fitness industry. So as you go through your training to become a cancer exercise specialist, know that you are going to be making a huge difference in the quality of life of cancer survivors. Part of our job is going to be to keep a positive attitude. Many cancer patients will have a renewed sense, appreciation of life. They take on better habits, they eat better, they get more sleep, they begin exercising, but there are going to be others who are depressed, understandably, and who want to commiserate about their circumstances. And it's our job to be upbeat and uplifting, kind of like a cheerleader, if you will. This is not a time to complain to them about your life situation. And that's a fine line, and it's easy to cross, because as you develop a relationship with your patient or client, I think many of us will become friends and extended family. But just remember to keep it professional, and that's going to help you as well, because this is your business, and you do have to have guidelines and practices and procedures. So keep it as clean as you can and be a professional, be there for your client. And remember, they're paying you for a service. They're not paying you to listen to your problems. We all have our own reason for becoming a cancer exercise specialist. I've shared mine with you, and many of you will have had personal stories. Either you've had cancer yourself, or a friend or family member has had cancer. In the thousands of people that I've personally trained, I can definitely tell you that a good percentage of them were motivated by personal stories. Whatever the case is, remember that you are going to make a huge difference, and every one of us builds this team that throughout the world is going to help change the lives of cancer survivors. And to me, that is so incredible. So what is cancer? Cancer develops when the genetic mechanism that controls the cell's growth goes awry and the cells multiply out of control. There are a number of different terms that I want you to become familiar with. One is dysplasia, and that is excessive cell growth. It is not cancerous, but it can become cancerous or malignant. Cancer in situ, or in situ, depending on how you pronounce it, is cancer that is contained and remains at its original location. And then invasive cancer means that the cancer has spread from its original location into the surrounding healthy tissue and into the bloodstream or the lymphatic system, where it can cause a secondary cancer elsewhere in the body. There are a number of different categories of cancer to be familiar with. Now, I'm doing an overview, however, for the purposes of what you are going to do as health and fitness professionals, remember to focus on what pertains to you and your profession. So a lot of this is going to be background information, which is important for you to know, but we really want to focus on as it pertains to prescribing exercise. So carcinomas are cancers that are in the organs or the internal and external linings in the body. Sarcomas are of the bone, the cartilage, the muscle, and the vessels. Leukemias are in the bone and the bone marrow. Lymphomas are the lymph nodes and lymphatic system, but this is not to be confused with lymphoma, which is a cancer of the lymphatic system. So I could have thyroid cancer that has spread to my liver and it has spread through the lymph nodes, but it's still thyroid cancer. And melanomas, of course, are skin cancer in its most deadly form. Gliomas are cancer of the brain and spinal cord. So those are the different categories of cancer. But what actually causes cancer? Heredity only accounts for about 5 to 10%, which means the other 90% of cancers are caused by things like radiation from X-rays. It could be ultraviolet radiation, radioactive chemicals, radiation in any form. Viruses such as Epstein-Barr, HPV, hepatitis B, obesity. Obesity helps account for 15 to 20% of all cancer-related deaths. And we live in a country where obesity is rampant. And lastly, chemicals or oxidative stress. This may be a word you're not familiar with, but you will become very familiar with it and realize that we are exposed to oxidative stress every minute of every day of our life. Toxic chemical compounds and pollutants that are in our body, just from the air we breathe, hydrogenated fats that we ingest, and all kinds of pollution, air, water, and food. Oils that have been heated to very high temperatures. Did you know that if you heat olive oil above 350 degrees, it can actually become carcinogenic or cancer-causing? We all know about cigarette smoke, despite the fact that people continue to not only smoke, but to begin smoking. Cigarette smoke, whether directly inhaled or secondhand, can cause cancer. Dehydration. We all know that it's important to drink water, but did you know that that can also be part of the whole cancer equation? Too much sugar. Sugar feeds cancer. Sugar can give you diabetes. Diabetes can also be a long-term side effect of cancer treatment. So all of this works together to basically make us unhealthy. We've got to avoid processed foods and sugar. Too much animal protein in your diet. And I am the worst because I eat a high protein diet, but at least try and make better decisions. Choose organic, grass-fed meats that don't have antibiotics. Also, geophysical stress, like living near power lines or waste dumps. And think about the Aaron Brockovich story and how all the people who live by a certain area begin to get cancer. We don't know exactly what is causing it, but there are definitely pockets throughout the country, throughout the world, where there are higher incidences of cancer. There are microbial imbalances, including bacterial, fungal, and viral infections that lead to cancer. And what about the preservatives in our food? Have you ever actually looked at a label and tried to decipher what half of the ingredients were? If you can't pronounce it, you probably shouldn't be eating it. Drugs, both over-the-counter and prescription drugs, can lead to some types of cancer. And artificial food colorings and flavorings. Once again, we have the word artificial. Plastics, chemical cleaning supplies, not only that we touch topically with our hands, but also that we breathe in the fumes. And chlorinated water that we drink, shower, or swim in. Alcohol. We'll have an entire section on alcohol as well as our diet. Alcohol can feed cancer cells, and alcohol is sugar. pesticides that are in our food. We're spraying our foods with things that will kill the bugs and the mites and what have you, but we're ingesting those same chemicals. Radiation exposure, X-rays, MRIs, mammograms, radiation from our cell phones, microwaves, God only knows what we're exposed to on a day-to-day basis. And psychological and emotional stress. Stress is a huge factor in many diseases. And exercise can also help to manage stress. It is a fantastic outlet. So know that exercise can play a huge role, but it is not enough. We still need to educate our clients. If you are not a nutritionist or a registered dietitian, it is not your job to put together a dietary program, but you can still talk about the basic food pyramid, basic guidelines, but please make sure that you recommend somebody who is not only a registered dietitian or certified nutritionist, but they specialize in oncology, because there are certain issues that they will know about that we as health and fitness professionals are not trained to know about. So while there is an entire section in your book which is written by a naturopathic doctor, master herbalist, and dietitian, it is there for background information for you, but it is not for you to just practice without proper education and training. So I just wanted to preface that. Now let's talk about genetics a little bit, because this is a big concern these days. We hear about Angelina Jolie and the BRCA gene, prophylactic mastectomies and hysterectomies, and are they overreacting to genetic profiling? Well, I can tell you personally, I had genetic profiling done last year, and a 21 gene test. I do not have any genes that indicate that I am predisposed to cancer, yet my entire family, as I already mentioned, has been inundated with cancer. So genetics isn't the only answer. It is still only accounting